Do you want to just stop existing and start living? My new book, A Deeper Wellness, can help you just do that. Through its 18 chapters and challenging self-reflective exercises, you'll learn how to heal your past, deal with the problems that you're struggling with today, and begin to build a future you want and deserve. Order a copy of A Deeper Wellness on Amazon.com or Amazon.ca. And now to our mindful moment. When words become weapons. In recent years, mental health terminology has crept slowly into the use of media and into widespread everyday usage. Let's take a moment to talk about how we should and should not talk about mental health, and how misusing mental health terminology really does cause hurt and harm. Despite the efforts of many mental health advocates, to this day, there remains a tremendous stigma around mental illness. Though we pay lip service when it comes to the need for society to understand, have compassion for, and support those who suffer with mental illness, there is also a rise in the use of mental health terminology to call out, wound, and shame others, as well as shame ourselves. It is not uncommon for a politician to accuse a political opponent of being mentally ill or challenged, and such remarks spread far and wide on our 24-hour news channels, where these intentions and fallouts of such remarks are rarely questioned or users called out for uttering such despairing accusations. Imagine, for instance, the outcry that would emerge if a political opponent dared to mock individuals suffering from heart disease, cancer, or physical disability. Of course, such behavior would not be tolerated, but when it comes to mental health, weaponization of diagnoses is ignored, or worse, seen as clever and humorous put-downs. Further, these weaponized terms are increasingly showing up in movies, television, social media, and online dating sites. We need these to stop. Hurt and harm. There exists a long list of mental health conditions and disorders, including PTSD, major depressive disorder, attention deficit hyperactive disorder, schizophrenia, substance-related and addictive disorders, gender or body dysmorphia, conduct disorder, OCD, autism spectrum disorder, and many, many more. The DSM, the Diagnostic and Statistical Manual of Mental Disorders, includes close to 300 disorders. Each disorder describes a cluster of symptoms, names, and terms. These terms are intended to be used amongst mental health professionals and clinicians or doctors to communicate amongst one another about symptoms for people to identify and understand in the course of treatment. A number of these terms have entered into general discourse, including narcissistic, psycho, psychotic, OCD, ADD, and ADHD. And much of their usage comes with the intent to hurt and harm, but not accurately describe someone's diagnoses. No matter what we're talking about, words really do matter. Words we say to others and words we say to ourselves. Many times we're hard on ourselves as well, and we describe ourselves with such terms. It is not healthy, and when a politician or political pundit accuses someone of being mentally ill or deficient, these words do matter on many levels. They matter to the person who is most often being labeled incorrectly and being insulted as mentally ill. They matter to the person who is struggling with a mental health illness and is afraid to speak up or seek help because of their judgment that they're worried about. And they matter to the individual whose treatment is being held back because they worry about mental health issues and what they look like and the stigma. They matter to the people who love and support someone who is struggling with mental health issues. And in a larger picture, they matter to every one of us, since most people in the course of their lifetime will experience or be close to someone struggling with mental health issues. Weaponizing mental health labels and diagnoses. Every mental health term describes a diagnosis. It is for the purpose of assessing and treating people. Diagnoses are arrived by a qualified mental health professional or physician after rigorous testing protocols, including psychological evaluations and consults, psychometric testing, and physical examinations. Any naming criteria that falls short of this is nothing more than name calling. and the weaponization of a terminology. For example, while the term narcissist may be useful in a discussion amongst clinicians to understand behaviors, it is virtually impossible to imagine anyone calling someone a narcissist in everyday conversation because that is unkind, to put it mildly. If someone labels a friend, acquaintance, or colleague as a narcissist because they're seeing self-absorbed behavior or thoughtlessness, they're misusing this term and essentially weaponizing this blanket clinical term that describes a serious personality disorder should not be misused. The term in such casual usage is intended to expose, shame, and injure the person who is being labeled. Just bad karma, just bad self-esteem. We're hurting people. Words do matter. Calling someone a narcissist may seem harsh and extremely a big example, but the truth is hundreds of people are doing it out there on YouTube, as friends, in colleagues, in professional environments, and this is not healthy. Many other mental health terms are equally routinely misused and abused. It's not unusual for someone to call a detail-oriented colleague or friend who hates to be late for an appointment or is meticulous as OCD. Equally common is the label of someone who's forgetful, distracted, or inattentive as ADD or ADHD. We label people whose unpredictable thoughts and actions or choices that come out of the blue as schizo or psycho, or people that are quick to anger as crazy, nuts, insane, bipolar, or psycho. A more compassionate approach. It is important for us to stop labeling ourselves and labeling others. The next time we're tempted to judge and belittle someone in our thoughts, in our words, it is important for us to remind ourselves that we should and we can do better. Remember that a psychological disorder refers to a deviant, distressful, and dysfunctional pattern of thoughts, feelings, and behaviors that interferes with someone's ability to function in a healthy way. This is a serious matter. If you or someone you love is struggling with their mental health, imagine the senseless hurt and harm that we cause by weaponizing such terms. Consider the effect on anyone that's close by hearing this. It is hurtful and it's negatively impacting people, diminishing their self-esteem, courage to go seek help, and discourages them to feel able to feel safe to talk about what they're going through. Let's try to be a better version of ourselves. Let's take a mindful moment right now and reflect on times that we have called ourselves names, belittled ourselves, been self-scrutinizing, and hurt ourselves or hurt others in times that we're not feeling good. I agree, when we're in pain, we spill over into others, and we do say hurtful things once in a while. But it is important for us, for our own well-being, as well as the well-being of others, to do unto others as you want done to you. Treat people kindly, compassionately, without name-calling and insulting. Let's take a mindful moment and reflect right now of words that we might throw around to others or label ourselves with that we need to cut out and become a little bit kinder, compassionate, and a little bit more thought-provoked and a little bit kinder. Let's take some compassionate moments right now and take a deep breath in and breathe out. Another deep breath in and breathe out. Reflecting in this mindful moment of words that you might be saying to yourself or others that maybe we need to pause and reflect and revise and change. As I gently welcome you back from this mindful moment, in your reflection, let's also pay attention to when we find ourselves struggling with the way we are being treated by someone poorly. We don't want to treat others poorly either. Let's really realize when we lash out with others by wounding them using mental health labels or insults. And let's start being kinder to ourselves by not limiting our vocabulary to hurtful words for ourselves. Self-scrutiny, self-harm, or harm to others is not healthy. When we see someone who is struggling or in need of help, we can behave more compassionately rather than demean or diminish them. And when we hear others misuse or abuse mental health terms, let's take charge and we can begin to contextualize these remarks as wounding words, as that's what they truly are. Let's pay attention and have a pause and reflect, watching our words. The more mental health terms proliferate our everyday vocabulary, the more we need to choose our words wisely. When it comes to mental health terminology in our day-to-day life, consider your intentions and the feelings of those around you before labeling someone with a hurtful mental health term. Reflect on your own choices and actions when you feel someone has harmed or misused or taken you for granted. Are you reacting in harmful words? Consider resolving interpersonal issues in a more respectful manner, speaking openly, kindly, and establishing healthier boundaries, healthier communication around your time and resources versus reacting in impulse and in being hurtful. Challenge others on their casual use of despairing mental health labels. Raise your awareness around mental health issues and challenges. The more you know, the less likely you will be to harm other people and misuse your mental health terminologies. It's hurtful, plain and simple, and it's important for us to take charge of behaviors we do that display low self-esteem and negative tendencies. Leave the labels to the professionals. Mental health terms are describing a cluster of symptoms and are intended for the use of professional clinicians treating patients and assessing them for their betterment, not for harm.